Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. As a reminder, please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video. As a reminder, again, take the online learning co-evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one. I have placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a free voucher for ROJoson telemedical consultation like this one. A request from me, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Ready? Okay, we'll wait for Lorly to get into the picture. Lorly, your camera. Lorly. Okay. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the 4th course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm and perseverance. So actually, we're starting on our 3rd year already. My pep talk today is entitled, No Tobacco, No Smoking, Awareness, and Advocacy. This is in consonance with the Department of Health Awareness Calendar, in which they have proclaimed May 31 as the World No Tobacco Day. This is also being declared all over the world. And then in June, the Department of Health has declared that month to be the National No Smoking Month. So the empowerment objective for this particular pep talk is for the lay people to have an essential understanding of no tobacco, no smoking, awareness, and advocacy in their health management. The contents of the pep talk will be the following: when, why, World No Tobacco Day, National No Smoking Month, what are the effects of tobacco and smoking, usually side effect or bad effects, how can you become addicted to smoking, how tobacco damages your body, how tobacco affects the way you look, what are the health effects, usually the bad effects of smoking, what are the effects on those around you, your relatives, your friends, and what related to this is what is passive smoking? And then what are the financial side effects or inconveniences or complications of smoking? Then reducing the effects of smoking. And then e-cigarettes, very popular nowadays. What and why not? And what is the smoking situation in the Philippines? And then lastly, what are ROJoson's health advice on smoking on a personal or lay person level? So I will be using these references as the main source of my lecture today. So since 1987, the WHO, or World Health Organization, has declared May 31 as the World No Smoking Day. May 31. Now, in the Philippines, the Presidential Proclamation number 183 in 1993, signed by the former President Fidel Ramos, who declared the month of June of every year as the National No Smoking Month in the Philippines. June is the National No Smoking Month. So this is actually an awareness and advocacy program that is being done year in and year out for the WHO since 1987. They started it. And then in the Philippines, for the National No Smoking Month, we started it in 1993. So the objectives of this program would be to raise the awareness of the danger of tobacco and smoking, and also to advocate against or no to tobacco and smoking. For today, I will, on my part, as a health professionals, through this pep talk, I will reinforce awareness on the danger of tobacco and smoking, and I will also advocate against no smoking, against smoking and tobacco use. This will be my contributions to the campaign. On your part, I would like to empower you to take care of your health by a no to tobacco and smoking, and also try to advocate against or a no to tobacco and smoking for your loved ones, your relatives, and your friends. This will be your contribution to the campaign. Now, what are the effects of tobacco and smoking? So just imagine if you start smoking tobacco, burn cigarettes. So within 10 seconds of your first puff, the toxic chemicals in the tobacco smoke, usually nicotine, that's the most common element, toxic element there. So this toxic nicotine will reach your brain, your heart, and other parts of your body, other organs. Smoking harms almost every part of your body, and increases your risk for many diseases. Smoking also affects how you look, I will discuss this later on, and how you feel, your finances, and the people close to you. Just remember that smoking leads to a disease or diseases and disabilities, and it harms nearly almost every organs or every parts of the body. How can you become addicted to smoking? So the most important element there in the smoke or the burnt cigarette is the nicotine. The nicotine in this tobacco is highly addictive. It makes your brain release a chemical called dopamine. So this dopamine makes you feel good. That's why it's called a feel-good chemical, which makes you feel happy, will help you to concentrate, and gives you more energy. So this is the good effect of the dopamine. But this effect doesn't last long. As the can somebody mute? Okay. how you become addicted to smoking. As the nicotine levels in your body fade, your brain craves for more dopamine. Gustong-gusto pa yung more dopamine. Sige pa, sige pa. The longer you have been smoking, the more dopamine you need to feel good. So you become dependent on the nicotine. Okay. Once you are dependent on the dopamine or the nicotine, without it, you will also have withdrawal symptoms. You will find it difficult to concentrate or feel nervous, restless, irritable, or anxious. So these two things, nicotine dependence and nicotine withdrawal, make you want to smoke more and more, so you become addicted to tobacco. The chemicals in tobacco smoke can damage your body in many ways. For example, nicotine narrows your veins and arteries, and this can damage your heart by forcing it to work faster and harder. It slows your blood and reduces the oxygen to your feet and your hands. Another example, the carbon chemical, another chemical, carbon monoxide, another chemical in the burnt tobacco would deprive your heart of the oxygen it needs to pump blood around your body. Over time, your airways swell up and let less air into your lungs. The other chemical is the tar, which is a sticky substance that coats your lungs like soot in a chimney. Kaya pag na-autopsy kayo, yung lungs niyo maitim na maitim because of the tar. Phenol paralyze and kill the hair-like cells in your airways. So these hair-like cells usually sweep clean the lining of your airways and protect them against infection. So if these are paralyzed and killed, you are more prone to infection. Tiny particles in tobacco smoke irritate your throat and lungs and cause the smoker's cough. This makes you produce more mucus and damages your lung tissue. The other elements, the chemicals, will be the ammonia and the formaldehyde, which irritate your eyes, nose, and throat. And then other cancer-causing chemicals can make your cell grow too fast or abnormally. This can result in cancer cells. Smoking tobacco can cause yellow-brown stains on your fingers, tongue, and teeth. So this is how tobacco will affect how you look. It increases your risk of tooth loss and bad breath. It also makes your skin saggy and gives you early wrinkles. Mukhang tatanda kayo na maaga. It makes your hair lose its natural shine also. So this is how tobacco affects the way we look once we start smoking. So what are the health effects of smoking? If you smoke, remember it can reduce your life expectancy or your quality of life. It can also increase your risk of many conditions and diseases, as well as of dying prematurely. It can be for a long time before smokers get the smoking-related condition or disease. Kaya sinasabi nila, walang problema, smoke and smoke, no? But the side effect would come in years and years after. And because of this, people believe it won't happen. Pag dumating na, magsisisi na sila. So in fact, up to 2/3 of long-term smokers will die of smoking-related disease. So sigurado yan, 2/3 of long-term smokers will die of a smoking-related disease, and then they will have their life cut short by 10 years on the average. 10 years on the average compared to non-smokers. There is a growing evidence to suggest that smoking has negative effect on the mental health. For example, some studies show that smoking is associated with increased rate of anxiety, panic attacks, depression, suicide attempts, and schizophrenia. Some of the conditions and diseases that can cause by smoking. So tobacco is one risk factor shared by four of the main categories of non-communicable diseases, which are very common. So these four diseases are the following: cardiovascular disease, cancer, chronic lung disease, and diabetes. So we've seen a lot of patients, people having cardiovascular disease, cancer, chronic lung disease, and diabetes. But most of these are related to smoking. Cancer. Smoking causes most lung cancers and can cause cancer almost anywhere on the body. So not only lung cancers, but other parts of the body. So this includes sa labi, sa lips, sa tongue, the mouth, the nose, esophagus, throat, voice box or larynx, stomach, liver, kidney, pancreas, urinary bladder, blood, cervix, vulva, penis, and anus. Dami, no? Okay. So aside from the lung cancers, all these other parts can be a cause for cancer formations. Breathing problems and chronic respiratory conditions. Smoking is the main cause of chronic obstructive pulmonary disease, or what is commonly known as COPD. This is a serious and progressive disabling condition that limits the airflow in the lungs. Kaya yung mga pasyente with chronic obstructive lung disease palaging naghahabol ng hininga. And there's no way out there. Usually it's progressive, it's usually irreversible na. Active smoking also worsens asthma if you have asthma in active smokers and associated with an increased risk of asthma in adolescents and adults. Asthma is also another issue here, another side effect of active smoking. Heart disease, stroke, and blood circulation problems. These are the cardiovascular diseases. So smoking is a major cause, such as heart disease and stroke. We have seen a lot of patients who smoke and who develop stroke and heart disease. Smoking increases the risk of blood clots, which block the blood flow to the heart, the brain, or the legs. So some smokers end up having their limb amputated due to blood circulation problem caused by smoking. Yung mga nangingitim na paa, no, because of smoking, na napupunta na end up with amputation of the legs. Diabetes is another condition which is commonly caused by smoking. Smoking causes so-called type 2, usually adult diabetes, with the risk of developing diabetes in 30 to 40% higher for active smokers than non-smokers. So yung diabetes actually is caused by other conditions. Smoking is one of them. But if you smoke, you have a higher chance of getting diabetes compared to not smoking. Smoking may also worsen some of the health conditions related to type 1 diabetes, such as kidney disease. Infection. Smoking weakens your immune system so that you're more likely to get bacterial and viral infection. Pag nag-smoke kayo, madali kayo makakuha ng upper respiratory tract infection and other viral diseases of the throat. Dental problems. Smoking increases the risk of gum disease, tooth loss, and tooth sensitivity. So once a person has gum disease, smoking also makes it harder for their gums to heal. Kaya usually, maraming problema sa ngipin, sa bibig. Hearing loss. The smoking reduces the blood flow to the inner ear. So smokers may also lose their hearing earlier than a non-smoker. So tandaan niyo, nawawala rin nabibingi or loss of hearing. And then the other one is vision loss. Smoking causes damage to the eyes and can lead to the so-called macular degeneration. And this is irreversible. Usually, nabubulag sila. Okay. For the women, smoking can cause more difficult to fall pregnant and affect sperm quality. So They usually end up with fertility problem. The other side effect of smoking will be osteoporosis and menopause. Smoking is a risk factor for osteoporosis, and in women may result in early menopause compared to non-smokers. So the effects of people around you, that's the next topic. As a smoker, you can affect the health of other people, especially your loved ones, when they breathe in your secondhand smoke. So this means they're breathing in the same toxic and cancer-causing chemicals that you are breathing through smoking. So what is passive smoker or smoking? Passive smoking is when someone breathes in secondhand tobacco smoke, and secondhand smoke is made up of one, the smoke that smokers breathe out, and second, the side stream smoke, meaning the smoke from the end of the lit cigarettes and cigars, yung sumisindi pa. Okay? So secondhand smoke is also known as environmental tobacco smoke. Is passive smoking ever safe? No. There is no safe level of passive smoking. So if you can avoid it, that's why there are now laws that prohibit smoking in places. Maraming ng areas in the countries that prohibit that smoking is prohibited. Studies have shown that secondhand smoke can harm you even if you are exposed for just 1 second, 1 moment. If somebody smokes indoors, the harmful chemicals in the tobacco smoke can stay in the room for hours, hindi lang saglit. If you cannot reduce the smoke to acceptable levels, even if you ventilate or filter the air. Tandaan ninyo, pag may nag-smoke sa kwarto, mahirap tanggalin yung smoke, totally yung mga chemicals. So it's only 100% smoke-free environment that can protect you from the effects of passive smoking. The secondhand smoke is a serious health threat. Take note of these statistics. For every 8 smokers who die from a smoking-related disease, merong din non-smoker na mamatay because of second-hand smoke. Hindi sila nag-smoke, pero namamatay pa rin sila because of the second-hand smoke exposure. Non-smokers who live with a smoker, kasi kung may asawa kayo, may kapatid kayo, may anak kayo sa bahay, if you smoke, no? You have a 25 to 30% greater risk of developing heart disease. Kaya sabihin niyo sa kamag-anak niyo, mag-stop ng smoking or umalis na lang sa bahay. Secondhand smoke can cause or worsen a range of diseases which include cancer, just like sa primary para cancer, heart attacks, heart disease, respiratory infections such as pneumonia, asthma, and diabetes. So pareho lang dun sa yung smoke. Passive smoker, ganun pa rin. Passive smoking, especially risky for those unborn babies, pregnant women, children, and young people, and also people with breathing problems, especially asthma. So what are the financial effects of smoking? So madaling intindihan niya, we don't have to really expound on this. We know that smoking is expensive. Kahit na isang sigarilyo lang bibili nyo, yung ba, isa lang binibili, pero kadalasan, it add up to 1 pack a day. Okay. So what more, magiging more expensive yan if you get sick. So because of the medical expenses that you have to incur. So how to reduce the effects of smoking? Okay, we have to remember that there's no safe level of smoking. Hindi pwedeng konti lang, pwede na. No? Okay, hindi pwede. Okay. So to reduce your risk of the smoking, the best option is to totally quit smoking. Outright quit na lang. Okay. Wag na lang. Okay. You will feel the health benefits almost straight away if you stop smoking. So let's now talk about electronic cigarettes, which are very popular. We see this very often. Okay. This is usually the result of kasi prohibited yung mga yung smoking in a lot of areas. Yeah, para sinicircumvent nila yung prohibitions, nagbe-vape smoking na lang sila. So the e-cigarette is increasingly becoming popular among Filipinos, particularly the youth, yung mga kabataan, as the number of public places that prohibit smoking is increasing. And the recent higher tobacco taxes in the country makes smoking more expensive. Mas mahal na yung mga ordinary smoking sa prohibited ng mga places. Kaya nagre-resort na lang sila sa e-cigarette, electronic cigarette smoking. So what are the e-cigarette? E-cigarettes are electronic devices that heat a fluid liquid, and produces an aerosol or a mix of more particles in the air. Ito yung nakikita mo yung bumubula. Okay. E-cigarettes come in many shapes and sizes. Most have a battery, a heating element, and a place to hold the fluid. So somewhere there in this, if you see this picture, somewhere is the battery, and then the container of the fluid, okay, and the heating element. Some cigarettes, e-cigarettes, are look like regular cigars or pipes. Some like USB drive, pen, and other everyday items. Larger devices such as tank system or mods, but they do not look like tobacco products. E-cigarettes are also known by different names. They are sometimes called e-cig, e-hookah, mods, vape pens, vapes, tank system, electronic nicotine delivery systems. So using an e-cigarette is sometimes or popularly now called as vaping. Pag naririnig niyo sa dyaryo, palagi may vaping. So this is for the use of the electronic cigarette. E-cigarette produce an aerosol by heating a fluid liquid that usually contains nicotine. Yan, itong nicotine. And then yung sa fluid na yon, nilalagay nila flavoring para may konting attraction, may konting flavor, and other chemicals that help to make the aerosol. The liquid used in the e-cigarette often contains nicotine and flavoring. Essentially, these are the two elements there, common. So this fluid is sometimes called e-juice, e-liquid, vape juice, or vape liquid. Users inhale e-cigarettes aerosol into their lungs. Pumapasok din sa baga. No? Bystanders can also breathe in this aerosol when the users exhales it into the air. So kung may nagbe-vape, may nakikita yung bubula, mahigop pa rin ninyo kung katabi ninyo. E-cigarette devices can be used to deliver other not only tobacco, but also marijuana and other drugs. This device can be used for that. So what is the bottom line on the risk of e-cigarettes for the kids, teens, and young adults? The use of e-cigarettes is unsafe, not safe for kids, teens, and young adults. Most e-cigarettes contain nicotine. Nicotine is highly addictive and can harm the adolescent brain development. Usually, nagko-continue yung brain development into the early mid-20s. We don't talk about yung mga bata. Now we talk about nicotine effect and concern natin. Kasi yung brain ng bata, umaabot pa na, nagko-continue pa yun up to mid-20s. But as I said, usually yung mga kabataan, mga mid-20s or even earlier, nag-smoke ng vape, ng electronic cigarette nowadays. E-cigarettes can contain other harmful substances aside from nicotine. Hindi lang nicotine, marami pang iba, hinahalo ng iba yung mga product endorser. Okay? Young people who use e-cigarettes may be more likely to smoke in the future. So aren't e-cigarettes safer than cigarette? E-cigarette expose users to fewer harmful chemicals than the burn cigarette. Pero meron pa rin side effect. But just the same, burn cigarettes and e-cigarettes are all harmful to active and passive smokers. So recommendations on e-cigarette, as these are risk. To reduce your risk for the e-cigarette, the best option again is to quit smoking. So don't go into e-cigarette. Huwag niyo subukan na. Stop it altogether. And you will feel the health benefits almost instantly. What is the smoking situation in the Philippines? I got this from one of the in the internet. So this is the most recent data. In 2019, 24 or 25% of adults aged 15 and above in the Philippines smoke. So 25% ng Filipinos smoke cigarette. There are 19.9 or 20 million smokers in the Philippines, 16% of whom were females, 16% babae. Okay? So the rest are lalaki. And smoking rates in the Philippines are higher among men versus women. So the youth prevalence rate for cigarettes have increased slightly from 8.9 in 2021 to 10.8 in 2019. So tumaas rin, pero hindi lang masyadong significant, but tumaas. Prevalence rates were higher among boys than girls. So in 2019, yung mga gumagamit ng e-cigarettes, 14% of the youth are using vaping or electronic cigarette already. So this was higher than the prevalence rate for the smoking using among the youth. Okay, yung mga nag-smoke among the youth. Okay, so 8.9 lang yung mga smoking, ordinary smoking, 10.8 in 2019, pero yung gumagamit ng vapes o e-cigarette, 14.1. So what are my health advice on smoking on a personal and vape person level? So again, I want to emphasize that there's no safe level of smoking. To reduce your risk, the best option is not to smoke at all, or kung nag-smoke kayo, quit smoking right away. Either don't smoke using the burn tobaccos or e-cigarettes. So totally no to tobacco, no to smoking. Don't smoke or don't vape at all costs. Ito pa paano? Quit outright. Avoid second-hand smoke anywhere from anybody. Tell your loved ones not to smoke, not to vape, and to quit if they are into it already. So do this advocacy and do these things also for you if you're smoking, if you love your body and yourself, and if you love your loved ones. So make every day a World Not Tobacco Day. So let's also take note of the celebration in June. Okay, so we can do it as early as May. We don't have to wait for June. We stop the smoking already. Okay. So summary and takeaway, I have discussed all of these topics. I won't repeat them anymore. Then takeaway in relation to patient empowerment, be always in touch with reliable medical information on tobacco and smoking. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment: kalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions in tobacco and smoking issues in One Health's management. So this ends my pep talk today, and I hope I have empowered you to have an essential understanding of no tobacco, no smoking in your health management. So before we go to the question and answer portion, let me remind you again, take the OLETE for a mastery of learning, and also 50 OLETE certificates with the Title 1 for a free voucher for our ROJoson telemedical consultation. And then feedback, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now go for a picture taking. Okay. Ready? Everybody ready for picture taking? Charlie, Bet Tumambing. 1, 2, 1, 2, 3. Oh, pahabol, Bet. 1, 2, 1, 2, 3. Okay. The floor is now open for questions, comments, recommendations, consults, etc., etc. Anything goes. Okay. We still have 25 minutes. Any questions? How many of you smoke? None? Nobody raised. Ganun na lang, ganon. Walang nag-smoke? Nobody in the group smokes? Jeng, nag-smoke ka?
No, Doc, hindi po.
Okay. So,
Doc, ako po may question na. Yung pong tatay ko, dati nag-smoke, kaya nung na-ospital, nagka-COPD po siya.
okay.
Emphysema, yung pong yung sinabi nung doktor, emphysema po ba yun? Tama po ba yung word?
Emphysema,
Opo.
okay.
Yun po yung naging diagnosis sa kanya. Kaya po pala tinatanong kami noon kung ang tatay namin ay nagsisigarilyo nung kabataan pa, kung ilang taon daw, kasi yun po yung naging cause nung kanyang, yun po yung tulad ng nasa natin na hindi po siya, yun po lagi po siyang hinahapo, hinihika, yung loss of breath, diba? Kaya po lagi siyang nag-nebulizer para lang po dun sa yun, sa kanyang sakit.
Okay.
Kaya sabi po namin, kahit sinasabi namin na wag nang magsigarilyo dati, hindi naman din po mapigilan. Di sabi nga po namin, yun na rin yung naging cause ng kanyang sakit. Yun nga pong hindi niya pagtigil ng sigarilyo.
Okay.
Yung pong emphysema.
Okay. So, ilang taon yung tatay, your father is still around?
Ay, wala na. Wala. Last year
Kailan
pa naman.
What age siya namatay?
88 po.
88. So, kailan, anong kinamatay niya?
Naman, Doc, hindi naman po yung niya cardiac arrest po yun naman yung naging cause ng kanyang death.
Okay.
Pero sabi nga po namin, baka sabi po, guwan na rin po yung sakit niya sa yung yung emphysema po.
Emphysema, kaya nga. Okay. So, up to the last moment, hirap siya huminga.
Opo. May ganun pong scene.
So, saan siya namatay? Sa bahay? Sa hospital?
Sa bahay lang po.
Sa bahay. Pero nakikita mo last moment, nahirapan siya huminga?
Opo.
So, nangitim siya?
Yun nga po, yung mga sign na sinabi niyo po, may ganun pong mga sign. Pati po yung sa paa, yung may nangingitim-ngitim po.
Pero yung papa mo, sa bahay siya namatay, di ba? So, karoon siya ng mga nangingitim mga kuko. Parang cyanosis, gano'n.
Parang nagba-violet, Doc. May ganun.
So, baka ilang taon na siya may emphysema bago siya namatay?
Naku, Doc, parang more than 10 years yata. More than 10 years po yata.
So, more than 10 years
siya in-hospital na
naka-nebulizer.
na-diagnose siya ng may ganun.
Pero 10 years na siya nagne-nebulize.
Opo.
And then, naka-oxygen ba siya?
'Pag naman po nasa ospital lang po siya nag-o-oxygen, 'pag nasa bahay naman po hindi naman po siya nakakapag-take ng oxygen, yun lang pong nebulizer.
Nebulizer lang, okay.
Hmm,
Okay. So pag matagal ang smoking, it can cause maraming klaseng disease. Pero yung sa papa mo, most likely nasira na lahat yung sa baga niya. Kaya they call it chronic obstructive lung disease. And then kung nasira yung mga lining niya, emphysema na. No? Emphysema means yung manipis yung sac, no? Na halo-halo na. No? So hindi na makapag-promote ng exchange ng mga oxygen sa carbon dioxide, no? Kaya palaging hihingal-hingal siya, naghahabol ng
tsaka
hininga, no?
opo. Tsaka yun
Oh,
po Dok, nagkaroon na rin siya ng diabetes.
ayan.
Samantalang kumbaga una-una wala pang nakikitang gano'n, parang nagkahalo-halo na siya. Dumami na
Oh,
yung kanyang sakit.
okay. Kaya nga most likely nauna yung emphysema niya kaysa yung diabetes, no?
Opo,
Nauna.
opo.
Okay.
Mhm.
So most likely, if we were to trace it, nauna yung smoking that causes a lot. Kasi diabetes can cause by something else, di ba? Baka yung mga genetics, no? Ganon, no? Okay. Pero smoking can also cause that. Kung nauna yung smoking niya, presenting as a problem, I mean, palagi siya nag-smoke, so it can cause diabetes, sabay, it can cause chronic obstructive lung disease or emphysema, no? Or it can also cause heart disease. Baka sabi mo nga, nung nasa bahay siya, doon siya namatay, no? Nag-cardiac arrest siya, no? So baka yung ends, yung pinakahuli, tinamaan yung heart niya, no? Okay.
Opo.
So tatlo yung ano niya, may diabetes siya, meron siyang lung problem, meron siyang heart, no? Okay. Okay. Ayun yung tumigil.
'Pag po may edad na mahirap na pong pigilan.
Hindi ba? Okay, tinanggap niya. Tinanggap niya.
Opo, siguro po.
Kasi ganun yung aking ano yung mga may lung cancer because of smoking, na lagi kong kuminsan binibiro ko, nagkaroon ka ng lung cancer kasi nung before you develop lung cancer, sinabihan ka na, di ba? Huwag ka mag-smoke, di ba? So, nung sinabihan ka, huwag ka mag-smoke, pinilit mo pa rin mag-smoke, di ba? So, kaya ka nagkaroon ng lung cancer, no? So, sabi
Suman
ko, lagi ko sinasabi, at this point, baka gusto mo na lang ituloy na yung smoking mo hanggang wakas, di ba? Total, pinili mo na yun eh, di ba?
Opo, hindi
So,
masabihan.
kadalasan ganun eh, di ba? Sisisi na lang sila, no? Pag andyan na. Kasi you will develop lung cancer from smoking mga 10, 20 years after eh. So akala mo, baliwala yung ano, di ba? Yung smoking. No? Yung effect ng lung cancer matagal. No? Hindi lang 1 year after, but matagal. Kaya they kept on smoking thinking walang mangyayari sa kanila. Di ba? Okay. So, pero yung iba naman, ay, baliwala sa kanila. Bahala na. Yan ang kaligayahan nila. Diba yan sasabihin nila, smoke na smoke, no? Okay. Okay, thank you for sharing, Jeng. Na? Anybody who wants to share? Yung pag-sharing ng mga participants maganda, nai-reinforce ating lecture. Na? Okay. Okay. Anybody else want to share or to ask questions? I suppose some of you have tried smoking before, kahit na 1 puff or 2 puff. Then after that, parang ano lang, curiosity. Then after that, tigil na, di ba? Nung mas bata-bata pa tayo, di ba? Parang tikim lang, tikim. Subok-subok lang. Okay. So when I was in college, ganun din ako. But nag-try out lang ako. Pero after that, ayoko na. Masyadong mabigat. Napipil ko yung poison pumapasok sa baga ko eh. Kaya tinigil ko after 2 or 3 cigarettes. No? So since then, hindi na ako nag-smoke. Anybody who wants to share their experience on smoking?
Doc,
Yes.
Susan.
Susan.
Yes, Doc. My comment has something to do with the campaign itself. No?
Okay.
Since the 80s, may campaign na world no tobacco hanggang ngayon. No? Oo. Ang problem lang, parang addiction din yan, parang drug addiction. Kaya hindi rin kaya hindi siguro what do I do? Parang hindi masyadong nakaka-push forward, no? Because first, we had the president who was a smoker. You know that. He couldn't be a good example. The campaign started during the time of Fidel Ramos, who's a very disciplined person who didn't smoke. No? Second, ang problema rin din sa campaign, meron pa nakalagay sa cigarette na yung mga nakalasulat doon na dangerous to your health, yung mga ganyan-ganyan na still those who want to smoke will smoke, no? Pero ang maganda rin sa campaign na ito na here you are telling us about the ill effects of smoking is that we're made aware, especially yung second-hand smoking.
Yeah, second-hand.
Yung second-hand smoking. Ang mahirap kasi, merong mga lugar na talagang where people can smoke. Kasi freedom pa rin nila. Hindi pa natin basta maban ng smoking. Because we also produce tobacco in Ilocos. Yun lang yung there is a balance, no? There is a balance na production and not taking the produce. Parang ganun. But I'd like to say that yung mga sinabi mo kanina, it really reinforces the campaign, no? Reinforces the campaign, especially yung mga hard facts that you told us earlier. Na especially yung mga diseases. Ano pala after 10 years saka nagkaka-epekto, yung ill effect lumalabas, is that what you said?
Which one, yung 10
after
piece?
several years? After several years, for instance, you smoke. You smoke 5 years and then you quit. Tapos, magkakasakit ka pa rin because of smoking. Is that it?
Yeah. Hindi kagad-kagad. Kaya akala nila baliwala, no? Ganon. So yung effect will set in, parang delayed effect, no? Ganon. No? So
sana pala ang campaign sa mga bata talaga, sa mga teenager.
Yeah.
Oo.
So dapat i-campaign against yung electronic cigarettes. Marami yan. No?
Yes.
Okay. So mahirap talaga ask everybody to conform to a good way of doing things, but we just try our best na lang. No? Okay. So have a knowledge about the danger, no, of smoking, and then try to protect yourself from the ill effects of smoking and also your loved ones. Ganun na lang. No? Okay. So mahirap talaga, andyan talaga yung kahit na mayroong ang daming campaign na, no? I think there's a country now that I was looking, walang country na may na totally ban ang smoking, no? Totally wala, no? So but they are trying to discourage people from smoking, no? I don't know which country. Singapore? Baka Singapore?
Brunei and Singapore. Baka.
That starting, meron silang starting 2018. They start from scratch. Basta 2028, nobody can smoke anymore. Nobody can buy ng mga cigarette at a certain age. So eventually, baka matanggal nila yung smoking. No? Okay. So, ang campaign kasi din ng WHO ngayon, sabi mo nga, may ibabalance mo, may mga nagpo-produce na mga tobacco, they make it a form of a parang occupation, di ba? Yung, parang livelihood, no? Okay. So, ang sinasabi ng WHO, why not transform it to other products, to other food crops na lang, no? Okay. Pero syempre, yung mga may pera, yung mga gustong pina-perpetuate pa rin doon, no? Okay. So, but the campaign to this year, 2023, ang campaign is to make alternative food products rather than tobacco, no? So, I guess it's really, number one, it should come from the government. Talagang dapat magagaling ito. So, yung pagtaas ng mga presyo, yung sa sin tax, di ba? Ang dami pa rin nag-smoke kahit paano, di ba? Of course, I think nadidecrease ng konti, pero andyan, palagi ko hindi siya mawawala, na? Okay. We'll try our best na lang. We can only do so much to contribute to this society, but we try our best na take care of our own self muna, and take care of our family, our children, gano'n. Na. Okay. So, any more?
Hello, Doc. Doc Ray.
Yeah.
Doc Ray, I forgot the name of the candy that would help you to quit smoking.
Ano?
Candy. There's a name of the candy that will help. It's quite expensive. When I was in Singapore, my son used to take it, but I'm not sure if we have it here in the Philippines.
I've heard about that. Yung they're trying to have a substitute for something na parang gradual, no? Gradual. Pero sa akin, I'm not absolutely against yung ganong strategy, gradual. Yung sa akin, outright tanggalin na, no? Basta there's a will, there's a way, discipline na, no? Okay. Kasi kung meron kang backup pa, kadalasan you fall back to this, parang yung mga drug addict, kung minsan, pag nawala na, babalik na naman yan, di ba? Okay. So, parang willpower na lang yan, willpower, no? But of course, it's easily said than done, no?
Matigas kasi ulo ng ako, Dok, Kahit anong sabihin ko, grabe.
Ano?
Matigas kasi ulo ng anak ko, Dok. 18 years old pa lang nag-smoke na. He's now 38, 36.
Yeah. Kaya yung mga education din ng foundation dapat turuan na no?
Oo nga po.
Mahirap talaga. Pero try your best na lang, no? Okay. So sa outright quitting na lang, wala na yung mga substitute, no? Okay. Any more? Perla, you're raising your hands?
I know, sir. I know, doctor.
Okay. So, anybody else who want to share smoking? I'm glad that nobody smokes in the group now. And then please extend the Andale. Okay. Paano ba ito? We still have 5 minutes to go, pero since wala nang tanong, ita-try out ko lang ito. Can you answer this poll? Yan ko. Titingnan lang niyo. Susubukan ko lang ito kung pwede. A poll on smoking awareness. Nakikita ninyo?
Hindi
Nakikita niyo sa cellphone niyo? Poll?
No.
Wala, doctor. Ay, wala po. Wala.
Hindi, Doc.
Okay. Madali
Wala po.
Yan, tinetesting ko lang Ilo-launch ko na yan. Ayan, nakikita na niya?
Yes, Doc.
Opo.
Yes,
Ah,
yes.
sige, pakisagot nga. Yes and no lang
Do
naman.
you smoke?
No.
Big
Sagot ko na to ah.
No.
Do you smoke tobacco? No.
Do you vape?
No.
Do you vape or use e-cigarettes? Of course, no.
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 Will you
Will
join
you join?
advocacy on no smoking?
Yes.
Yes, of course.
Sige, yung mga may ano. Testing ko lang. Dalawa pa
Submit.
na sumasagot. Ayan, apat na
Okay na,
sumasagot.
Doc.
Apat na, sige. Andito ngayon, 12 at 10, at least 5. Sige. 6. 7. Okay, 7 na. Wala na?
Will you join? Will you join?
Nakasagot na lahat?
Yes.
Submit. Submit.
All of you, nakikita niyo itong poll? Lahat kayo? Sa
Yes,
cellphone niyo?
wala na siya ngayon.
Yes,
Pero ngayon, kanina nakita ko.
Apo. I'm done also.
Nakikita niyo yung poll?
Opo.
Done. Oh, done na, Doc.
With your cellphone, nakikita niyo.
Kanina, Doc, kanina.
Previously, Doc.
Kanina, Doc. Ngayon, hindi na.
Ngayon, hindi ko pa na...
Pero
After
nasa
I submitted, there's no more.
after I submitted, no more.
after you submitted, wala na. Ganun ba?
Yes. Yes.
Hindi
Okay.
ko masubmit.
Okay. Sandali ha. Ay, tinetesting ko lang ito ha. Tinetesting ko lang. I hope you ano. Okay, i-end ko na yung poll. Titingnan ko how it will be. So 8 out of 8. 8 out of 8 says no. 100% no smoking sa inyo. Then how will you join advocacy? 8 out of 8 says no. 1 out of 8 says yes. So yung isa ayaw sumali sa advocacy ko. Tama? Okay. Advocacy. Okay. 8 out of 8. No. Okay. I'll end the poll. Okay. Tapos na yung poll. Paano yun? Okay. Tatabi ko muna. So nasagot niyo, but I'll see if I can make use of this kind of a poll during the prep talk. That will be an improvement. As I told you, after the second year of prep talk, I'm trying, majority says, yes, we will continue with the prep talk. I will continue, but I will try to make it, to come out with some improvement. Na? Okay. So, kasi wala rin sumasagot sa when I ask for feedback on the chat box. Konti lang nagta-type no? No. So, I'll see if I can make use of this poll na lang. No? Okay. So, any more questions? Any more comments before we leave?
Another comment,
Sure.
Doc.
Susan.
Have you tried, for instance, talking in symposia for especially mga high school or college about no smoking, you as an advocate, kasi that will be a very good ano rin eh.
And I think that other people are doing it.
Okay.
Other people are doing it. Ako, lalo na yung mga societies, di ba? Medical societies, let's say, lung cancer, lung center, then yung mga pulmonologists, society pulmonologists, na part of their program during the mga no smoking month, they try to talk to the public, no? Okay. So sa Facebook meron din, no? Okay. So marami yan. Of course, as you said kanina, despite all of these things, no, hindi tayo 100% successful, but at least we are trying our best, no? Okay. Ganun na lang. We just look at it that way. Try our best na lang, no? Okay. So hindi mo talagang mapipigil yung talagang pasaway, wala tayong magagawa, no? Okay. As long as they die contented. They die na ano, tanggap nila na yan ang kinamatay nila. Okay na sa akin. Di ba? Kasi pag mamatay sila, nagsisisi sila, bali wala. Di ba? So that's why sabi ko, yung mga may lung cancer, sabi ko, sige, mag-smoke ka na lang hanggang mamatay ka. Para ituloy mo na lang. Okay. So meron Susan na. Okay. So on my part, I can only do so much. Ito na lang. Dito sa pep talk, probably this could be once a year lang. No? Next year, probably during the June next year.
And your Facebook and YouTube also has advocacy on that, di ba?
Yeah. Okay. So, Facebook. I also post on Facebook, di ba? Okay.
Social media.
Okay. Any more comments? Okay, if there are no more comments, we'll call it a day. So we'll see each other next week again. Okay. I still don't have a topic for next week, but I will think about it. No? Okay. So any topic you want me to talk on? Wala. No specific topic.
I will send you.
No.
I will just send you on Messenger.
Sige. Sige. If you have a topic that you want me to talk on, just tell me right away. Give me 1 week to prepare. No? Okay. But I will still follow the DOH calendar. Actually, meron ako isang topic na develop na, but this is for June 3. This is the cancer survivorship because the first Sunday of June is considered as National Cancer Survivors Day. No? So yan ang inuna ko. No? Okay. Dinaon ko dun sa June 3. June 3 ang celebration. No? So, pero for next week, wala pa akong topic. So I will try to find it to write up on the topic for next week. No? Okay. So if there are no more questions, we'll see each other next week. Thank you for listening.
Thank you so much, Dr. Ray.
Thank you so much, Doc.
Thank you, Doc.
Thank you po.
Doc.
Bye-bye.
Bye.
Bye po.
Bye, Doc.